Hello, welcome everyone. Thank you all so much for being here and for taking the time to be a part of such an important conversation that we hope will bring you information, resources that you're searching for to support your young people, and particularly Black girls in your communities as well as your schools. I do want to just take a note here to mention that I know many of you may be feeling a mixture of emotions with the election results. And so I do want to highlight, and I want you all to know that we stand with you in our heart and our soul at MBWJI. And I think today is a perfect day to have a conversation in why we're centering Black girls and their mental health. Um, and so without further ado, my name is Tanaj Moody. I am the Director of Capacity Building and Learning at the National Black Women's Justice Institute. And for many folks who are on here who are new and may not know about our work, our mission is to research, elevate, and educate the public about innovative, community-led solutions to address the criminalization of Black women and girls. And we envision a society that respects, values, and honors the humanity of Black women and girls, and takes accountability for the harm that it has inflicted, and recognizes that real justice is about healing. And I'm hoping this conversation can bring some of that today. So I want to start by sharing a fact that may be hard to hear, but I believe is also really important to know. Every day, Black girls in our schools are faced with unique and unfair challenges. At MBWJI, we polled educators from across the country about the stereotypes and labels assigned to Black girls. And unfortunately, what we found were mostly negative. The stereotypes that came up were most frequently were Black girls are loud, angry, aggressive, followed by mean, grown, or ghetto, sexual, dramatic, and also smart. These perceptions that stem from harmful biases and stereotypes don't just lead to misunderstandings, they can result in harsh and punitive policies that create toxic environments that ultimately damage Black girls' mental health and pushing them out of the very schools that should be nurturing their success. And in too many cases, these experiences increase the risk of involvement in the juvenile legal system. In some states, Black girls make up 50% or more of all female student arrests, and they are subjected to school discipline, including suspensions, expulsions, and arrests on school campuses at a much higher rate in frequency to their peers. But today, y'all, we're not here to just talk about the problem, but I want to raise awareness to the problem. We're here to talk about the solutions. And that's why I'm really excited to introduce to you the launch, snaps, to the CARES initiative, which stands for Creating, Affirming, Responsive, and Equitable Schools. The CARES initiative is generously funded by the New York Women's Foundation and the Tao Foundation. The CARES initiative is going to serve as a national training, assistance, and resource hub for schools, educators striving to implement trauma-informed, culturally affirming, and gender-sensitive policies and practices that ultimately foster safety, belonging, and opportunity for Black girls and gender-expansive youth. The first tool to be added to our resource hub, which I'm really excited, which is why all of y'all are here today, is the launch of our CARES mental health assessment tool. This tool is our response to ending school pushout and centering Black girls' experiences, needs, and concerns. What's really amazing about this tool is to develop this tool, MBWJI reviewed and consulted the existing landscape of mental health assessment tools and resources on school mental health systems. We also convened 2 advisory councils, one that was comprised of young Black girls and the other with professional subject matter experts. And we conducted listening sessions with them to support the guide and the development of this tool. So today marks the beginning of a two-part, yes, this isn't just the first, we will have another one, which will be next week, more to come on that. So today marks the beginning of a two-part webinar series to launch the CARES initiative and the CARES mental health assessment tool, which is a resource that has been built with Black girls for Black girls and gender-expansive youth and experts in the education and mental health field. And so this tool is more than just an assessment. I want that to be known. It's a guide that's going to help schools to implement and has helped schools to implement policies and programs that prioritize the mental health and well-being of every student, and especially Black girls. So today in session 1, y'all are going to be introduced to some amazing educators who supported the pilot launch of the CARES tool this year. And y'all are going to get a preview of the tool because it's officially launched on the website. And so in today's conversation, you're going to be hearing from incredible educators at Brooklyn Emerging Leaders Academy and Democracy Prep Public Schools. And we're going to have some of our folks here going to be sharing their insights and their experiences on how using the CARES mental health assessment tool has transformed their approaches, as well as empowered them to better support the unique needs of Black girls in their schools. So let's get started. So I want everyone to please give a warm welcome, put it in the chat box, put some emojis in there, give some energy to welcome Miss Camille Gale, who is the Chief of Student Affairs at Brooklyn Emerging Leaders Academy, and also who will be joining us shortly is going to be Mr. Rashid Ducereau, who is at Democracy Prep Public Schools Civic Program Director. And so first, hello, Camille.
Hi, good afternoon, everyone. Super excited to be here. Thank you for that beautiful welcome and for centering this conversation, Tanaj. Humbled and grateful to be here. So I serve as the Chief of Student Affairs at Brooklyn Emerging Leaders Academy, also known as Bella. We are in our 8th year of existence and are in the amazing, historically rich community of Bed-Stuy, Brooklyn, where we have a lot of amazing ancestors that have really opened the doors for us to support the work that we do in serving our young women of color from all kinds of neighborhoods in Brooklyn, whether it's close by. We have students that travel in from Staten Island. We have students that come from all 5 boroughs just to be a part of the community. And our mission is really about empowering our young people to be the best version of themselves and recognizing that because of life experiences, they come as the best version of themselves looks different every single day. And from year to year, it looks different. So we were really grateful because we do center our, social and emotional well-being of our young people. It's equally as important to us as their academic growth. So finding out about the CARES tool was really kind of a no-brainer for us to be a part of. We are so inspired by the work that has preceded us around, making sure that we create safe spaces and schooling spaces that are healing centers for our young people, and not fall into the push-out methodology. So when we had the opportunity to be a part of this survey, we certainly jumped at it. And yeah, it's been an enriching experience ever since.
Lovely. I appreciate you, as well as your partnership. And, I really want to ground us in the conversation. I think it's important to give some background and understanding as to why this tool is so important. And so I want to really discuss some of the challenges that Black girls face in school settings, including trauma they may be exposed to as it relates to disciplinary practices and different ways on how this tool can begin to address those challenges. And, I want to start with the conversation with you because you also have a background as a licensed clinical social worker, and you're also a former teacher, amongst all of the other hats and things that you do, Camille. And so I would love if you can share with our audience, discussing around like how trauma and the exposure of that can affect Black girls, and how the CARES mental health assessment tool supported you and your team in addressing some of those mental health challenges faced by Black girls that may have experienced trauma within your school setting.
Yeah, I want to echo what you started off the conversation with, is that this is a pretty powerful day in history for all people, but certainly for young women of color. And oftentimes I think, they kind of pack their traumas up and keep moving forward, or they're certainly expected to. And so we get them in high school. We serve students in high school, and they come in with, not just trauma that you might see in the world and in their lives, and neighborhood trauma, but really educational trauma is a huge part of what we see. And so trusting educators, feeling safe to speak to wrongs that have been done to them, feeling as though their voices are being heard and respected and valued, is something that we do a lot of work around unpacking. And so one of the things that we think about is we think about the trauma of their physical being, right? Like what they actually hold in their bodies, how that manifests, how, you know, frankly, their menstrual cycles are more intensive due to the stresses that they chronically hold. We do our ACEs surveys with our students because we know that the ACEs is adverse childhood experiences is linked to chronic health illnesses in our young people. And we see that from them in their teenage years and all of the things that they're holding. Then I think about the emotional aspects. And again, like having to build trust for them, how they communicate, how they've had to communicate, their sense of safety and their sense of power in this world, the toxicities that kind of embody some of their experiences. And certainly this is not the experience of every young woman of color. Want to definitely clearly define that, but that is a lot of what we see of how trauma comes into our building. And then sort of the academic aspect of is another way that I think about it. I am keenly aware of, and I think many of us are, of the impact of trauma on our brain functioning. And one of the things I think about all the time, and it's actually what propelled me from teaching into social work, is students cannot learn until they feel safe. There's
Mm,
learning brain versus survival brain. And survival brain is always going to come out on top. You cannot learn if you do not feel safe. So it was actually understanding that as a teacher, and I'm there trying to like support these students and teach them things, and they're filled with all of this trauma that they're walking into the classroom with, and I'm like, how could you possibly learn anything? So trauma looks like a lot of different things within our school community. And I also just want to talk about how important it is for schools to be that healing center, not only for students, but also for families, because there's also an intergenerational aspect of, trauma that shows up for them. So by the time they're with us in high school, they have been through educational systems that not only have not listened to their voices, but have not listened to their families' voices. The amount of work that we do around building partnerships with our families and say to them, they say to us, well, my high school experience was terrible. I was essentially pushed out. I was a problematic student because I was dealing with XYZ. Nobody ever talked to me about it. And so our school takes a very different approach to all of that. And we like to think of ourselves as sort of a trauma-informed, healing-centered space. We have a lot of supports in our school. So one example is that we have a social worker for every grade, and that social worker follows our students for all 4 years. So they really get to know the students and the families really well. And that ACEs is also delivered to our students actually ninth grade year. So we kind of get a sense of like, not exactly what your trauma is, but what have you experienced before you've kind of landed at our doorstep. And then in addition to that, for us, we do not have sort of a disciplinary code. We've kind of taken a different approach, very much influenced by the work of Dr. Kusan. I think I'm saying her name right. And really just thinking about how we empower our young people. So we have, in place of a discipline guide, we have a student empowerment guide, our Bella Empowerment Guide, which really outlines all of the things that I'm talking about and all of the supports that are there, but also when a young person makes a decision that is in alignment with our core values, how do we help them to get to the root of that decision and also make more informed choices around how their own trauma is impacting things? How can we support them in healing some of that trauma so communication is better? So I say all of that. And then I say how the tool really helped us. We have been doing this work and kind of like moving forward and, learning as we grow and develop. But the CARES tool was really an opportunity for us to gather different community members together, students, staff, family members, our board member, and sort of pause and think about the work that we're doing and how is it really serving our young people? How is it serving the intersectionality that's coming into our spaces? How is it serving, we certainly, like you said, have some expertise, but there's no greater expertise like our young people and their families to tell us what supports they need. And so the tool was really helpful to pause us and ask really specific and intentional questions around what we're doing and how we're doing it.
I hope y'all are taking notes, everybody, because Camille just dropped a whole bunch of gems. Camille, thank you so much for sharing all of the amazing work that Bella is doing and is continuing to do, as well as how, the tool has helped to provide and continue to add value to that work. You said some things that I really wanted to highlight. You mentioned around the importance of a learning brain versus a survival brain. And you also said, students can't learn until they feel safe. And I just want to uplift that because I thought that was really important. Because it brings me to my point of, in the assessment tool itself, y'all will see there's some links that are being shared in the chat box with everybody. We've shared testimonies from our youth advisors who served on our council to help guide this tool so that we could better learn from their experiences. And one of the testimonies from one of our youth advisory council members talked about fears and discomfort around, seeking help from schools as well as from counselors. And they had mentioned, I'm going to read off of what they had shared. They had said, I feel like not everybody wants to help because if you tell your problem to the guidance counselor, they're going to have to tell somebody, and that you're either doing something that you're not supposed to be doing or you're hurting yourself and you don't want that. And it's hard for you to tell somebody, and it's even going to be harder because they may tell other people. So they try to give you hope, but you just don't feel comfortable. And I want to uplift that quote because one of the things that you had mentioned, Camille, was really creating schools to be a healing space. And then you also mentioned about Bella having this empowerment guide. And then, coupling all of that, the part around the CARES tool, around how we convened, right? We convened students, we convened licensed social workers, educators, community members, family members to be a part of this conversation. And so I want to talk a little bit about what you had shared, right? And so, we convened this team, which we called our CARES Wellness Team, to support with the implementation of the tool. And so I want to talk a little bit on how the creation of that CARES Wellness Team that you mentioned, which included family members, students, teachers, and licensed social workers to really, how did that influence your approach with using the actual assessment tool? And how did you find those collaborations to be helpful in addressing your students' mental health needs?
Yeah, I think sometimes as part of admin, you just kind of move along and you think you're doing the best based on one or two thoughts here or there, but you know, pausing and really like hearing from other members of the community just really impacted, you know, things that we have been using that maybe we were like, oh, we need to kind of look at this from a student's perspective, actually. And how do we get from point A to where we want our students to be at point B? There's, you know, there's some gaps that need to be filled in. And so the students that were on our session were so helpful in helping us to fill those gaps in and helping us to rewrite some of the stuff that's in the empowerment guide. It is a living document. And then also, I think hearing from the family members was really powerful. And for me, what was powerful about that is we are doing so much, but I don't know if our families always see what we're doing and why we're doing it. So again, to have that transparency around like, this is why we're asking for your signature on an ACEs survey. This is what happens with all of that information. And this is why we do things the way that we do. I think our families, we are very fortunate that we work closely with our families, so they do trust us. But I think filling in again those gaps of like why and how we do things was really impactful for that parent, because now she can go out and advocate to other parents and say, oh, this is what they do and why they do it. And the parent that was able to join us, you know, is a very active parent who has her own mental health degree in a way because of the how much she supported her young person with mental health needs. So it for me, I think the biggest piece of it was really the pause, the reflection of our work, and then also getting input from different constituents.
That's amazing. Thank you so much. I appreciate you for grounding us in the discussion on the importance of addressing Black girls' mental health at a time like right now, as well as, you know, highlighting ways that we can come together as a community, as a collective, to better support Black girls' mental health, and how the CARES mental health assessment tool has supported and aiding in that. So I really appreciate you and for the work, as well as for everyone on the wellness team. If we have anybody on the wellness team on this call, shout out to everybody who's on there.
And I say
Additionally,
thank
yeah, go ahead.
you. Was I just your role was super helpful.
Oh,
Having the discussions facilitated by someone who wasn't in the work with us was really helpful. And I think the resources you provided were like so phenomenal, because I think I told you, I was like, still have like a bucket list of all the things that I want to go through and look at, because other schools are doing amazing work and we are always thinking about what is a best practice, what is something that we're missing the mark on. So the resources and the facilitation that you provided, and there were times when those of you that work in a school, you know, it's like, oh gosh, we got to get on this call. We don't have this is going on, that's happening. But when I got on the call every time, it was like, that was so helpful. Everyone on the team was like, yeah, we had conversations afterwards about the resources and like, how can we utilize some of these practices in our work right now? So shout out to you.
oh, thank you. I will receive all of that. I appreciate it. And y'all definitely have made it easy for us as well. So thank you for that. And so, you know, I think there's have been so many great insights that you have shared in understanding the impact of trauma on Black girls, as well as their experiences with our CARES wellness teams that were supporting and guiding throughout taking the assessments and then implementing some of these resources that we were just sharing and talking about. And so I really want to dive into the discussions around the 6 domains. And so we're gonna join us back, Camille. You're gonna join us back here. And I want to say to folks as well, if there are specific questions that y'all have for folks that are joining us, please feel free to write them in the chat box. We will definitely make sure to address those questions at the end of this if there's time, and if not, we will definitely be sending up follow-ups to make sure that we're addressing any questions. I did see a quick question in that chat where someone asked, like, what grade are we talking about? So we are referring to high school students. So I wanted to answer that. I saw that in there. And so for folks that may not be aware, this is the launch of the CARES initiative. And I really want to dive a little bit further into some of the details around what's inside this actual tool. And so I want to have a discussion around the 6 domains within the tool. And these 6 domains within the tool are being used to support schools in identifying the gaps and areas of improvements for schools' mental health policies, practices, their programs. And I really would love to have Rashid, who's on here, to really share more about your experiences, working with your school, because I know as an educator, you've been an educator now for over 13 years. You're a seasoned educator, and you've supported with developing educational materials and making sure that they're accessible as well as digestible, right, for all students. And so I would love for you to talk a little bit more about your experience with the tool relating to the domains. And so y'all, if you're not aware, we have 6 domains within this tool that are different assessments, and they're based on teaming, resource mapping, multi-tiered systems of support, mental health screening, as well as referral pathways, funding and sustainability, as well as data and impact for supporting mental health and wellness of Black girls and gender-expansive youth. And so there's these several different assessments that each of the schools have taken. And so, Rashid, I would love for you to, maybe not address all 6, because we'd be here all day. But if you could talk a little bit of, which of these 6 domains in the CARES assessment tool did you find to be most helpful in your work, and why?
Certainly. First wanted to say greetings to everyone, and also just thanks for the opportunity to share a little bit about the democracy prep experience. I do want to acknowledge Destiny Stewart, who is our Director of Social Emotional Wellness, who really established the opportunity for our school network to participate. So in our work with the CARES assessment tool, I would say that domain 3, the multi-tiered system of support, has been one of the most insightful. It's been one of the most impactful. That domain allowed us to explore how our policies and our practices align with trauma-informed, culturally responsive approaches, and where there might be some unintended biases. And by focusing on our school discipline, we were able to address areas where traditional practices may have disproportionately impacted Black girls. And I think the assessment just highlighted a number of critical areas in our approach that needed some focus with regard to trauma-sensitive practices. So, for example, in the data from our assessment, there was an indication that while there's a general adherence to trauma-informed practices, the consistency was an area of growth. With trauma-sensitive discipline having a score that was not at all what we had expected. It wasn't remarkably low, but it also wasn't as high as many of us probably anticipated before participating. So the score brought attention to the need for stronger standardized approaches in handling discipline issues that could be particularly sensitive for Black girls, who are often affected by implicit biases and, again, disproportionate consequences in our school systems. In terms of mental health practices, a specific gap that we identified through the assessment was the need for comprehensive training for our staff on culturally responsive behavior management. Our score for training in positive classroom management skills, and that includes maintaining clear expectations and understanding underlying issues, was lower than anticipated as well. So the highlighted gap in our ability to equip staff to manage behavioral challenges in a way that supports students' mental and emotional health, while reducing our punitive measures. I guess another key insight that that was revealed to us was the need to actively monitor and analyze discipline data to understand our disparities. Our assessment showed a significant gap in using data to identify and address disparities in discipline practices, with an average score that was somewhere in the middle to high area. And of course, when folks start using the tool, I think they'll be more familiar with some of the numerical scales. So
Yeah.
I won't put everything out there, but I will say, when we were looking at all our numbers, we were just certain areas did elicit some pretty strong reactions from us in terms of the need for immediate action. But the specific gap that I had mentioned just points to the importance of consistent data analysis to ensure that certain student demographics, including Black girls, especially Black girls, aren't disproportionately affected by, exclusionary discipline practices. And if you'd like, I can talk about some of the resources and strategies as well, just for addressing those gaps, if you think there might be.
Yeah, I think that was super helpful because, we're definitely, I would love to talk a little bit about even the scoring aspect of things too, for folks that may not be aware. And I want to just thank you. I want to thank you for taking the time to share that, with our audience here and talking a little bit about how the scoring process really served as indicators. And I think it's important for folks to know too is that the scores, we made sure that, and we talked about this in our different sessions that we were in, the scores are to serve as a marker, right? We talked about, how they're really indicators on where can we improve and where are our strengths and where are some areas that we can grow in. And so, you talked a little bit about the different areas in which it helped prep really identify an area of growth, which was around the multi-tiered systems of supports. And you were talking a little bit on the scoring aspect thing as well. So I would love for folks to get an idea of how those scores for the multi-tiered systems of support served as like a starting point to improve, right? Different policies or the practices for enhancing your school's mental health programs for Black girls. Maybe if you could talk about if there were any specific resources that would be helpful for the audience to know more about.
Yes, so I will also provide some context to folks and just say we are a charter school network as opposed to a particular campus. So I think some elements of implementation will look very different for certain schools as compared to what we did. So although I can't speak to specific tools that were implemented across the board, we definitely discussed in our time together in our wellness teams various resources that address a lot of the gaps that we've been discussing. So the National Center for School Mental Health's Quality Guide on Mental Health Promotion gave us some helpful strategies for creating restorative discipline practices and offered guidances on implementing school-wide trauma-sensitive approaches. And then the Girls Circle model was explored, as a potential way to provide Black girls with a safe, affirming space where they could feel supported, and helping them mitigate the negative impacts of punitive discipline and building stronger senses of belonging. But yeah, I think overall, just Domain 3 in particular, as well as the tools that were provided, just really played such an important role in guiding us towards more equitable and trauma-sensitive discipline practices. So I'll pause there.
Can you talk a little bit about, because I think it's important to know is that because prep is not just one school, right? It's like this umbrella. And I think that can resonate with a lot of other educators that may be on this call that may not operate in like a traditional high school environment, right? And so can you kind of talk a bit about like what were the challenges that you faced given like this is a different type of ecosystem, right, that you're operating in, and there's so many different layers to that. Can you talk a little bit about what challenges you faced, and how working with us or even the tool helped to kind of address those challenges?
Yeah, I mean, thank you again for the opportunity to share our experience, especially as, we used a lot of the initial scores to guide our improvement across all of our mental health practices. And I think the tools definitely helped us focus on evaluating and enhancing the support systems that we had in place. One of the biggest challenges for us was that there was just there were varying levels of familiarity of staff with direct student interactions. And some team members, like myself, don't work with students daily. And so we had to adapt the assessment just to allow staff to, select unsure when we weren't directly knowledgeable about a question, which made the process more accessible and it kept the data more accurate. Another challenge was just the disparity in practices across multiple campuses, with differences in implementation, specifically as they relate to culturally responsive discipline practices. So again, we were looking at our scores and just seeing how a final score, an aggregate score, didn't account for the schools that were really strong in one area and had a lot of areas for growth in another.
Mm-hmm, mm-hmm. That's super helpful. I think it's important to highlight the pros, the cons. It comes with a balance, right? And so I appreciate you for uplifting those different points. And I think, I want to talk a little bit about the importance of parent and community engagement with this tool, because that was a big piece. And I think it's a critical piece to the development of this tool and making sure that this is as inclusive as possible. And so I'd love for Camille to join us in this conversation as well, to really explore the importance of parent and community engagement in supporting students' well-being through the CARES tool. And so really, Camille, Rashid, this is a question for both of you. I would love for us to talk a little bit more about like what actionable steps can folks take, right? Can people on this webinar today take away individually, collectively, whether we have educators on this call, organizers, activists, students, family members, right? Licensed social workers, all of the above, to really ensure that the insights that you all gained within your schools from the CARES tool can lead to lasting changes in your schools, right? That truly support the mental health and the well-being of Black girls in your schools. Camille, can we start with you, and then Rashid, could we go with you next?
Yeah, I think that a couple of big takeaways for us and actionable steps for us was, one, the importance of having the diverse voices. And so, again, I think that our students individually tell us things and all of that, but to have a forum where students are actually like part of policy making and part of, assessing the policies and evaluating it. That actually has happened this year, that our head of school has been meeting with students regularly through their leadership academy. And I know a lot of other schools call it advisory, we call it leadership academy. And there's been a student from each cohort that meets with the leadership team once, I believe it's once a month. Can't remember if it's once or twice a month, and just have been kind of talking about things that are happening in the community, primarily from a behavioral perspective, and then what are some things that students see that can shift the culture of behavior in our school, the hiccups that may be there, the compliance, non-compliance issues. And that has just been such a powerful forum to experience. And I do think that that's directly correlated to sort of sharing some of the feedback and how powerful this, wellness group has been, and how important it's been, and how we do need to center the voices of our young people a little bit more. So that's one thing that I think is sort of like a indirect but direct impact from the CARES tool. And then I think the other big thing for me was reinvesting in the importance of the assessment tools that we use. So our lowest score was around data and impact. And so we do all of this incredible work that I think is incredible work. But we don't have the data that's backing it up because we're busy doing the work. And so for me, it was sort of this moment of being like, all right, we need to renegotiate this. We need to do pre and post survey tests. I remember having a conversation with you of like, yeah, when I look at our data, actually, we haven't, we didn't do the ACEs with all of the students because it was hard getting family signatures. So we did a direct push that this year, every student, every family is at least aware of and signing for those surveys so that we can do the ACEs, so that we do know what we're dealing with our young people as we're implementing our social emotional curriculum, doing a pre and a post survey. And those were things that I think we talked about, but until seeing those scores on the CARE survey and until really realizing the impact of it, I was not sort of like prioritizing in the same way. And so I think that became a real priority for us, we know that what we're doing has been impactful, but how do we show that with our data, which was our lowest score in the CARE survey. So that for me was just really influential, those two pieces.
Thank you so much, Camille. I want to ask as well, as a sidebar, because you and I worked very closely together when it came to the actionable steps of things towards the end. And so for folks that are just learning about our CARES tool, because today is the launch, part of this CARES tool that I also think is very unique is there's a lot of technical assistance that is involved within this tool. As Camille knows, Rashid, Destiny, who we've worked very closely with, there was a lot of one-on-one towards the end of the 6 domains that were taken to really prioritize with each school on which of these domains do you really want to focus on based off of the scores, and which ones should we really hone in on and provide resources for implementation going into the new school year. So Camille, you and I worked really close together for almost a little over a month or so, and so much time. So thank you again. And so working really with each other to really create a strategic action plan. I would love if you can talk a little bit on just like what that process was like for us working together on creating that strategic action plan. And so, we focus on the data and impact, as you mentioned, as a point of a highlight. Could you talk a little bit about that strategic action planning process and what that experience was like for you and how it helped you?
Yeah, I think that I was like very overwhelmed, and I was like, this is great information, Tanaj, thanks. And you were like, all right, but what's the next step? I'm like, yeah, we'll figure that out. And we would have these meetings and talk about it. And I think for me, as you can probably tell, a talker, a processor. So it was helpful for me to just kind of like, what does this actually mean for our school, and how can this improve? Like, what does improved practices look like? What do improved practices look like? So for me, I think it was the talking through, and then, I think I was looking at the document that, we created the other day, and like, well, here's what it is. What is an actionable step? So again, for me, it was the time to pause and really have the thought partnership that was really helpful in making the next step actionable, and even sharing it with our head of school, and her helping me to also like make it more actionable, that okay, we have all this great information, what will we do with it now? And additionally, the resources, like kind of clicking, what do other people do, what does this look like in other schools, in other communities, was helpful. There is a question in the chat that I want to answer about the ACEs scores. So we are very intentional about delivering it. Our social workers are the only ones that deliver it. We have a class where our social workers meet with students weekly, and once there is enough comfort level, I don't know, for those who are familiar, it really asked questions around what experiences did you have that may, incite some trauma in your life. And so we do not ask our students specifically what their trauma is, because that is just not appropriate and not fair, but we talk to them about what trauma means, what it looks like. There's a lesson around resilience that goes with it. And then we do ask our students to do that. Families are aware of it, and the way that we use the score is for us just to assess the needs of our students. So one great example, our team did the ACEs score last week, and one of the social workers said to me, like, wow, I would have never known that this student had such a high ACEs score, because the student is quiet, they don't really get into trouble, that kind of thing. And I was like, well, great, this is what you can use in your individual counseling session to process those scores. So we are very, very responsible about how that gets used and what the follow-up is. And for us, it's really a tool to understand like where are students that need more supports that we may not be aware of, because they don't walk in necessarily saying all of that stuff to us. So I just wanted to say that as well. And in terms of with families, the way that we do it is listening to families and their experiences as well. We work a lot, not just with our students, but with our families, and those relationships are like a 4-year journey. And so there's, we can't do everything year one. They don't know us and fully trust us year one, nor should they, but really earning their trust and developing that throughout. So just wanted to share that, because we try to be very responsible about how that's delivered, and our parents are all aware that we do deliver that.
Super helpful. And thank you. I believe that was CC Norwood who uplifted that question. So thank you, Camille. I want to also pass the baton over to Rashid. Can you also talk a little bit about what are some actionable steps that we can take individually and collectively to ensure the insights that your school gained from the CARES tool can lead to really lasting change within your school to support the mental health and well-being of Black girls?
The 3 steps that I would recommend are: 1, integrating culturally responsive practices; 2, building collaborative action plans with diverse stakeholders; and 3, establishing ongoing evaluation and feedback loops. So definitely one of the most valuable aspects of the CARES tool was how it helped us see where our culturally responsive practices could strengthen our mental health frameworks. And at Democracy Prep, we realized that there were gaps in the approach to trauma-informed discipline and positive behavior reinforcement, especially in ways that recognize the unique experiences of Black girls. So moving forward, we can all commit to embedding culturally affirming practices into our mental health support structures, whether that's through dedicated training on bias and cultural sensitivity, or creating affinity spaces where Black girls can connect and be seen. Another key takeaway was just the importance of collaboration. The assessment highlighted the need to go beyond school walls and work alongside mental health professionals, community organizations, and families. So for us, this meant exploring partnerships with a number of organizations to bridge gaps in expertise and resources. And just bringing in outside voices and resources can also enhance what we're able to offer internally. And engaging families in our planning processes definitely ensures that the strategies are inclusive and representative of students' lived realities. So we can also all commit to building those partnerships, which would add depth to our mental health support systems. And I think the final one, just the assessment really underscored the necessity of regularly evaluating our impact. At Democracy Prep, we found that while some areas like school climate and had really solid structures, we weren't consistently monitoring discipline data disaggregated by our demographics. So by establishing these ongoing feedback systems, we were able to use data, and we are able to use data to ensure that our practices are equitable and responsive. And then using the feedback mechanisms, whether it's regular check-ins, data reviews, or open forums for students and families, just allows us to adapt our approach based on real and evolving needs. So we're just really grateful for the opportunity to have begun working with this tool. And so, yeah, I think that's probably those would be my top three.
Super helpful. I love the part you added, all of it, and highlighting the collaboration approach. I think it takes a village. It takes a village to do this work. And we have to ensure that all voices are centered in doing this work. And so thank you for uplifting that and sharing some actionable steps. So I would love to just add a part here. Are there any last remaining thoughts or comments that you would like to share about our partnership, or even within your schools, of something that is important for the community to know about that you would love to share? Camille, feel free if you would like to start. Any upcoming events that you have or anything?
Oh. Oh, okay, yes. So speaking of affirming young women of color, we do have a March Women's Symposium event where we invite women from all different walks of life to come and share their journeys with our students. Really not from the perspective of like, oh, I'm so-and-so and chief of so-and-so, but really like what got you there? What were the real triumphs? What were the tribulations? How did you persevere? Wanting our young people to be exposed to that. So definitely, if you are in the Bed-Stuy area on March 28th, it is a really special and dynamic experience. And it's also an opportunity for women to support other women. So we also have like a networking event afterwards that, yeah, we've had people come back year after year. We have people come from New Orleans and Atlanta to just be a part of it. It's a very special day. So I will put my information in the chat. And if that is something you feel called to come and connect with our students in our community, happy to have that happen. But also just really want to offer gratitude to, to MBWJI for all the work that you all are doing. As I said earlier, the work that you all have done for years has really influenced like how we looked at school, at our school, and how we shaped the school to be something that has been reimagined. So our vision is that, the experience of schooling for young women of color will be a transformational experience. And that, not only to kind of hit on what Rashid said, it is not just for our students to be transformed by the work that we do. It's for us as educators. It's for our families to be transformed. It's for anyone that sort of touches our community to be transformed. And so this was such a beautiful partnership, and there was so much synergy and alignment for us, and really pausing and assessing what we're doing and making sure that we're doing right by our young people and families, and just continuing that work. So thank you for allowing us to be a part of it, and shout out to my head of school, Nisha Fullwood, who is just a dope, amazing woman that has had the vision for not only this school, but this partnership.
Absolutely. Absolutely. Thank you so much for that, Camille. Rashid, how about yourself?
I briefly want to address, I see in the chat, Chan, you asked a question about the girls circle model. So I will tell you, I can't speak to it fully because again, that was on a campus level, but my understanding is where like our participation using the CARES tool was really a diagnostic and evaluative element. The girls circle model is more about an implementation level. So after the initial like understanding of where we are, then girls circle would be the complement to using the tool. So I just wanted to acknowledge that. I'm sorry for the
No, it's okay.
yeah.
Thank you.
But I would also just say this experience has truly been, and this partnership has been one that gives me a lot of confidence and hope in the work that we're doing for the students that we educate. I will tell you all that when Destiny Stewart, again, who is our director of social emotional wellness, when she approached me and said, "Hey, are you interested in joining?" I kind of was concerned. And then through a conversation, it just became more apparent. In my role, I serve as the civics program director for our organization. And we just, you understand that prior to encouraging kids to go out and change the world, they really just need to have a deep knowledge and love of self and to be connected to communities that are affirming. Not just of who they are, but what their dreams are and where they come from. And they need to feel safe emotionally. They need to feel safe physically. They need to trust in systems. And I think especially now, in light of the recent events with regard to the election, faith in systems is something that we need to just continue to build out. It's something that, efficacy and a sense that, well, if I advocate or if I speak up or if I reach out, am I going to get what I need? Am I going to be heard?
Yeah,
So I think a lot of what we do has been influenced by this tool, and just getting the opportunity to work with you, Tanaj, it's just been really wonderful to have someone as responsive to our individual organizational needs and just following up with additional resources and making sure that all folks in the conversation were heard. It was so well facilitated. So just couldn't speak highly enough about the CARES assessment tool and specifically working with you and the rest of the team.
I'm gonna get emotional. Thank you.
I would love to actually add one more quick thing is
Yeah.
that our school did a shape survey that is very similar, but we did that like last year. And that was helpful, but I think what was helpful about doing this with you all was the centering of, the cultural competency, the intersectionality, the focus on young women of color. Like that for us was really transformational to think about. So, there are tons of assessments out there. There are lots of different ways in which to sort of look at the work that we're doing. But for us, having this specific lens, having the lens of like not having exclusionary disciplinary policies, like that was what we needed. So thank you all for creating that. It wasn't just a one size fit all. It really, I would echo what Rashid said. It was really tailored for our needs in our community. So I would
Absolutely.
encourage people to use it.
Yes, that part. Absolutely, absolutely. Thank y'all so much. And I just want to uplift what you just mentioned, Camille, because that was part of the development of this tool is, we looked at the landscape. We looked at the landscape of mental health assessment tools and resources in school mental health systems. And we saw, there was a gap, and the gap was an intersectional lens that's trauma sensitive, that is looking at gender and is looking at race, and then being able to cultivate and convene young Black women and gender expansive youth and other subject matter experts to support with the development of this is what makes this tool so unique and special. And so I want to thank both of you, you know, Democracy Prep, Bella, for your partnership, as well as for your time, your energy, because I know y'all wear many hats and you do many things. And, you know, to be able to coordinate wellness teams, because if y'all don't know, we had about 7 people per wellness team. And that's a lot to do, right? In a school setting. Many educators on this call may know, school administrators may know the time and effort that that takes to coordinate not only people that are working within the school, but also the students and the family members. And so I do want to uplift Rashid and Destiny, who couldn't be with us today, but and Camille, you know, just for your time and energy, and for all of the wellness team members who have been in support of launching the pilot of this, and now for the official launch into the public. Ooh, that's exciting. It's crazy, but I'm really excited about this. And so I just want to thank you both. And if you're comfortable, for folks, feel free to put your contact information or your school's website so folks can learn more about the amazing work that you're doing within your schools. And I would love to, you know, spend some time to introduce folks to the tool. And so I would love to give a preview of the tool with everybody, give some insights because it's officially launched on our website. And then if we have time, we'll bring back Camille and Rashid for some questions. There may be some questions if we haven't answered those in the chat. And if not, we will also answer some of those questions offline too. Thank you so much, Camille and Rashid, and hopefully we'll join back shortly. All right, so we're going to preview this tool. We're going to get into this tool. And so for many folks, it is officially live on our website. We've been sharing the link with y'all in the chat box if you don't already have that in there. And so we're going to walk through this assessment tool with each other. I'm going to briefly review with you all both of these tools. We're going to be reviewing our actual workbook that has all of these amazing resources that Camille and Rashid were sharing about. And then we're also going to talk about the assessment itself that includes those 6 domains that Rashid and Camille were sharing about as well. So I'm going to share screen and kind of walk you through so you can kind of see where everything is, where you can get access to it because it's in the public now, and you can download it. And then, of course, you can contact MBWJI, myself, if you would like to begin implementing this into your school, into the new year. All right, so give me one moment. I'm going to share screen. All right. Okay, so all of you should be able to see my screen. If you are not able to see the screen, now is the time to let me know so we can make any adjustments. All right. Hopefully everyone can see it. So this is our beautiful website. And so I'm going to walk you through some of what is in this on the website, as well as, like I mentioned, the workbook, as well as the assessment. It's important to note that the difference that I'm going to be walking you through is I'm going to first show you the workbook, right? And so there's 2 of these. There's the workbook and then there's the assessment. And you're going to see here, I'm going to look over onto my other side because of my screen. This first page here is going to be the workbook at this top. And then under it right here in purple, you can see this purple graphic here. That's the assessment tool itself. Now, what is the difference between the workbook and the assessment? Like I mentioned before, the workbook is going to include the resources and the information that your school needs to help to understand how their mental health policies, practices, and even programs, the things that are currently in place are contributing to the emotional well-being of your students, and particularly Black girls. And it's almost a guide that's also going to talk a little bit more about those 6 domains in depth. that are really going to be guiding educators through an intersectional and a gender responsive and trauma sensitive lens, right? So I'm going to open it up. So when you're on our website, if you just go to where it says resources, it'll take you to this tab. And so you'll see a bunch of our resources on our website. And some of this, particularly the ones that we're going to go over, are these first two. So when you click on this first one, it'll take you to a PDF document. And the PDF document, I hope all of y'all can see that. Let me know if you can't. There should be a young woman on your screen holding a book. And this is the actual workbook itself. And so if we scroll down to page 2 of this document, you can download this, you can print it out, whatever it is, you can do it. And so on page 2, what I love about this, as well as the assessment itself, is that this is hyperlinked. So anything in this table of contents, if you want to go to a specific section, rather than having to scroll through everything, you literally can just click on a specific header and it'll take you directly to that section. And so I think for example purposes, what I'm going to do is I'm just going to click on one of the first domains. There's 6 domains, like I mentioned earlier, but for this first domain, we're going to click on teaming. And also I want a shout out to our designer, Sade, as well, who put so much time and energy in designing this beautiful workbook resource, as well as the template. And also a special shout out to our communications team who supported with putting this onto the website as well. So we're going to click on teaming, and this is going to be similar to how this is going to look throughout the actual workbook itself. And so you'll see teaming is domain 1. This is the first domain. And so for each domain, you're going to see what each domain is about, why it's important, best practices and strategies. And then it's also going to include templates. So all of the domains are structured in the same format. So there's not going to be any surprises. And like I mentioned before, it'll give you background around what teaming is and why you need to know this and why this is important. And so teaming as the first domain, similarly to as we were talking about before, right? The importance of us convening a CARES wellness team. That was our first step in developing and implementing these assessments. We created a collaborative approach that involved a multidisciplinaries, so licensed social workers, educators, families, students, all the above. And that was the first domain that we actually covered when we were working through these assessments with both Bella and Prep. And so it'll talk to you a background on what teaming is. And then, like I mentioned before, it'll offer you different best practices, strategies, resources. And also a fun fact about this, I really love this. You'll see throughout this workbook that there are different quotes that are from our youth advisors who have helped to guide the development of this tool, where they are sharing their personal experiences as it relates to mental health in academic settings. And so you'll see quotes like this from one of our youth advisors. It says, "I always wondered what would happen if I did have an African-American as a teacher, or an African-American woman as a teacher. I think that there would just be a different connection or a different schooling experience in general. And I really want to have that happen. I really want a teacher of color." So I love seeing this because it's directly centering the experiences and needs of Black girls, which is what this tool is all about, and gender-expansive youth. And so you'll see there's different strategies throughout here. And then we also have hyperlinks that will take you to different websites, as well as glossary to learn more about different language that's used in here that folks may not be aware of. And it's very comprehensive. And so there's different domains, domain 1, 2, and so forth. So I encourage you to take a look at this on your time. And then at the end of this workbook, including our the assessment too, at the end of this, you will see, in addition to these templates that are also really helpful, that are some of the resources that Camille and Rashid touched on, we have our contact information too. So I'm going to scroll down here. And all of our contact information is at the bottom of this. So if your school or someone is interested in learning more about the CARES tool or how to implement the CARES tool, or is interested in technical assistance around the CARES initiative, you can contact us, and all of our information is on here. But again, y'all, take some dives in to this so you can really sit with it. It's very comprehensive, super thorough. We went through a rigorous process to even get to this point. And this is meant to be a collaborative approach. So this is not just meant for one person to implement. This is meant for an entire team to really work together and work through this with each other. So this is the workbook, right? Like I mentioned, the workbook is just going to have all of the resources, templates, best practices, and strategies around those 6 domains that we discussed before. Now we're going to shift gears, and I'm going to share a little bit on the assessment tool. So if you go back to our website, where it has the resources back where I was mentioning before, right under the workbook, you're going to go to where it says the actual assessment tool. And so these were the assessments tools where Rashid was talking about a little bit on the scoring process and like what that was like for them, what that experience was like, and how it helped to identify different gaps and areas of strength as well as areas of improvement. And so this is one of the things that I think is really different about the assessment tool versus the actual workbook guide is one of the obvious things is that this is the assessment tool, right? The assessment tool is offering a roadmap essentially for creating school-based mental health systems to be responsive to all students across all social identities, right? And really particularly highlighting Black girls and gender-expansive youth needs. And it's helping, like I mentioned before, to identify the gaps within your schools. It's helping to identify, are there gaps in the mental health policies that we currently have or in the practices or programs? And it's looking through that intersectional, gender responsive and culturally sensitive lens, as I mentioned before. So when you go to our website, you'll click on here, and this will take you directly to the tool. And so the tool itself, beautiful, shout out to Sade again. This tool itself, again, our table of contexts, everything is hyperlinked. So if there's this particular domain or assessment that you want to go to, you can go directly to it, and you can download this as a PDF, you can print it out, right? So many different ways that you can access this. And so with this, particularly since we were already on the example of teaming, we'll stay on that example. So for example purposes, you'll see all of the different domains that we were talking about. It'll also give you background on how we created the tool, why we created the tool, and then it gives you basic instructions on how to use the tool and the assessment. So teaming, resource mapping, the multi-tiered systems of supports assessment, which was one of the assessments Rashid had mentioned, which was an area that their school really worked on, the mental health screening and referral pathways assessment, funding and sustainability assessment, data and impact assessment. And then additionally, we include a bonus in here, which are metrics to consider that could provide better insights into the needs and outcomes for Black girls. And then finally, you're going to see here the strategic planning guide, which Camille touched on. But I'm going to show you really quick here. So when you click on the using the tool, it's going to give you basic instructions on how to use the tool. It's going to talk to you about how do you prepare, right? And so it's going to give you background information on the CARES wellness teams that we talked about. How do you bring together folks to be a part of this, right? So it's going to walk you through how to prepare. It's going to talk to you about like, how does the assessment aspect actually work, right? And so it's also important to know is that the assessment rating is from a 0 to 6. And the 0 is because when we launched with Bella and Prep as a pilot, one of the things we noticed is that some of the questions were not all applicable to that particular person because they may not have worked within the school. And so we wanted to make sure that there was a specific section that could address that need if this question wasn't applicable, that wouldn't impact the school's responses as well. And so it's rating from 0, which is unsure, all the way up to number 6, which is strongly agree. And then at the end, the scores are calculated by the total score divided by the number of assessment statements that are within that domain. And so you'll see when you go to domain 1, which was the teaming one that I was referring to, it'll again walk you through, give you the instructions. I want to highlight here is that you don't have to do this yourself. You can also contact us. We can walk you through this and we can show you exactly how to do this as well. But if you want to take it on, feel free. It's yours for the taking. And so this is how the assessment tool will look. It'll walk you through different questions as it relates to teaming or that specific domain. And then at the end, of course, we got to reflect, y'all. We got to understand what is it that we just took and how is this going to really help us and how can we begin to implement some of this? And so there's reflection questions at the end of each of the domains, which I think are really helpful for a teaming aspect to really sit down and review and have those open, candid conversations with each other. The last thing that I want to highlight on here was the conversation that we had with Camille, which was around the actual strategic planning, right? And so after you're done taking all 6 of the assessments, mind you, it depends on what kind of pace you want to take these assessments in. You can take them on a month-by-month basis, which is what we did with Bella and Prep. That takes very long and it does require a lot of coordination and scheduling. That is one way to do it. Or you can take them all at once and then we can prioritize specific assessments that you and your school would like to really focus on and implement into the school year. And so, you know, with the strategic planning guide, this aspect of it, Camille and I were talking on this, and we also did this with Prep as well, where we really honed in on what is a specific area based on the domains that you really want to focus on and create a plan around. And like, how can we really tailor the resources around implementation for you? And so for the example, Camille had shared, you know, when we were working on the strategic planning guide, we really focused on data and impact, right? Which was one of the domains. And so we prioritized that area. And then we worked through, many of y'all may know this, the SMARTY goals. And so SMARTY goals stand for strategic, measurable, ambitious, realistic, time-bound, inclusive, and equitable. And based on the SMARTY goals, we then further developed out what is that specific domain that we want to focus on? What is the goal and how are we centering equity and inclusion in that goal around the data and impact, right? And then from there, talking a little bit about what are some of the opportunities that are existing within that goal and what are some of the barriers, what are some of the current available resources, right? All of this is meant to be a conversation. I want to add, all of this is meant to be a conversation. And again, we can work with you on how to complete these different steps. And then from there, you know, we work to really create an action plan. That is like your short term, which would be your 0 to 6 months, to your midterm, to your long term, based on your prioritized areas. And this is overall, you know, you're leaving with actionable steps after you've evaluated and have a good understanding on what are the different areas in which your school wants to grow in as relates to mental health policies, practices, and programs. And then at the end, of course, after each of the the short-term, midterm, and long-term plans, there's also reflection questions too. And then all of our contact information is at the end of both of these workbooks. So I hope y'all are excited because there's a wealth of information in here and resources that I really think are going to change the landscape of how we look at mental health and how we address mental health for Black girls and gender expansive youth, and ensuring that we're centering them in all of our policies, our programs, our interventions, and so forth. And so this is our gift to all of you. And like I said, you guys can get access to these things directly on our website. Our workbook is downloadable today. Share it, scream it at the top of the mountaintops, all the things, as well as the mental health assessment tool as well. So I'm going to stop sharing here. And I'm going to invite some folks back in the room to see if there are any questions that we may have from audience that we weren't able to address in the chat box. Let's see. Okay, so it looks like there were some questions, and I'm gonna go through them. So welcome back, Camille and Rashid. So we have some questions that I think most of these have already been answered. Let's see if there's any. Yeah, most of these questions have already been answered throughout. So thank you both, Camille and Rashid. Someone just asked, can this tool be used in Ohio? Yes, why not? So yes, absolutely. And the other thing to note is, you know, we had an opportunity to actually visit Bella and had an opportunity to tour and to meet folks. And so we also had an opportunity to meet with folks not only in person but virtually. So we both worked with Bella as well as Prep virtually on a month-to-month basis. Camila, Rashid, do you want to talk any more a little bit about the virtual aspect of things and if that was helpful or anything else you would like to add to that?
Sure. I mean, I think the virtual element made it a lot easier for us as a national organization to have voices from different campuses and different work contexts. So we operate in New York, Nevada, and Texas, dramatically different landscapes. So for us to actually gather in this space dedicated to our conversations about the CARES assessment, it was incredibly helpful to be virtual.
Great.
Camille,
would you like to
I
add?
shared Tanaj, that was my least favorite aspect, was it being virtual. And for me, that's really because, again, busy school day, like when you know someone's in person versus, you know, you have to click on a line, that made a difference. But every time I got on the call, like I said, it was always so well structured and worth it, and just felt really like meaningful, intentional time. So I think, yeah, it was also helpful for our family members or other stakeholders to be at the table for it to be virtual. So definitely, I worked through my own stuff around virtuality, but it was helpful in getting everyone at the table.
Absolutely. Ideally, in person would be great, right? But we do both, so we can do both. It's accessible in that way. So yeah, absolutely. I see some other folks asked in here. Oh, someone said approximately how long does the this is a great question. He said, how long does the entire process take from start to finish? Thank you for asking that. You will have to have patience. I'm just kidding. But really. And so it can take anywhere, you know, from, it depends on how you take it. Let's say that. You know, working, and Camille, Rashid, feel free to jump in as well. I'll start though, you know, working both with Bella and Prep really helped us to understand what are some of the best ways in which we can actually implement this assessment tool that isn't so much of a heavy lift. And so some strategies around how we can implement this is that, like I mentioned earlier, this can be on a month-to-month basis, right? So how we did this initially was each of the schools took the assessment month to month. So there were 6 domains. So that means there was 6 months. So each month a school took the domain, we reviewed with them, we had a workshop with them, we shared resources with them, we reviewed their scores, their highest and their lower indicators, as well as their areas of strength and some areas of growth. And we did that each month. And so each month we worked with the schools directly, tailored specific resources to the schools, and all of the schools did the work of taking the assessments collaboratively with their CARES Wellness team each month. Additionally, one of the things that we talked with one-on-one, with both Bella and Prep were, what are some alternative strategies that could work on implementing this process that would be helpful, maybe if someone didn't have 6 months, right? And so some ways of additional strategies on how this can be taken is you can actually take all of the assessments maybe in a one-time period if that's what you feel called to do, right? And from that, that typically would take anywhere from an hour to 2 hours to take all 6 of the assessments. And then from there, you're then able to work directly with us if that is something you feel called to do, where we would then prioritize specific areas and work directly with you on implementing resources, as well as a better understanding on your score report for where we need to grow. And so that can take anywhere from, 2 to 3 months, if you will, if that is the route that a school or an individual or even an organization decides to take. So it just depends on the approach. Camille or Rashid, would you like to add to that? Or maybe even talk about what was helpful, or maybe
I can say it was helpful for us to do it in doses and to do it once a month, because we could really sort of digest not only this, we could be intentional about the scoring, but then also about processing the results and thinking about next steps. So I think the pacing for me felt really good once a month and once a month was the meeting. There were other things that we did alongside that meeting, like taking the assessment and, also kind of connecting with each other.
Absolutely.
Yeah, I think the collection of all of that data, it's just, there's so much data on how our schools are doing, how our kids are doing, so I think breaking it into pieces will allow for more intentional implementation of any programming that you'd like, to follow up from what you found from the data. Doing it in an entire sitting, it seems quite daunting. I'm actually thinking about doing that, and it fills me with a little bit of dread. But if it's necessary, then that's what you have to do. If you don't have the actual time, then maybe as a retreat, it would be a good idea, and you take the full day and do it. But otherwise, I think most folks, when you do this, you will appreciate having it broken into smaller portions to take a deep dive with the data versus kind of cherry picking the best pieces from everything.
I love that. I might steal that retreat idea. We might have MBWJI CARES retreats. That's good. I like that one, Rashid. It looks like we had one more question. So we do have time for one more question. And so the question asked, what did financial support look like during and after the assessment completion? So there is a specific domain. I hope this is answering your question. There is a specific domain around funding and sustainability. And so that domain is basically about identifying and addressing to what extent does the school use best practices or resources or strategies for funding and resources for actually maintaining their school's mental health interventions. And so we work with the schools on identifying, what are the specific funding resources that are being utilized? And then we share additional resources that schools may not have access to or be aware about. And we also share different templates. I know, Camille, when you and I worked together, we talked a little bit about grants, right? We talked about like, how do you fill out a grant? And so you and I worked specifically together where I tailored a template on like how to fill out these grants, right? To really apply for additional funding to support mental health programs. Camille, did you want to talk a little bit about the funding and sustainability, that part that I was just sharing?
I think that's always the challenge in our work. And I think it was helpful to just, again, use not only the tool, but also the, the data that we collected, like Rashid said, around like all of the data that we used in order to get the information for the CARES tool was helpful in thinking about utilizing that information now that it's gathered in grant writing. So yeah, that was helpful.
Thank you. All right, y'all. So we are out of time. It is 4:32, and I want to say thank you so much to everyone who's attended. Thank you, Camille. Thank you, Rashid. Rashid, please thank Destiny for us. Camille, please thank Miss Marcia for us. For all of your time, your energy, your partnership in supporting the launch of the CARES mental health system assessment tool. Yes, I am excited. And so next steps, y'all. This is, like I said, part one of another part of our webinar. So we have another webinar coming up on November 13th at 6 p.m. Eastern. Mark your calendars. And in this second session, you're really going to hear directly from the adult advisor experts who contributed their expertise in developing this CARES assessment tool. And so I want to thank you all. Please RSVP. At the end of our webinar, you're going to receive a survey for us to figure out, different ways of how we can better support you. And if this webinar was helpful in different ways, we can further improve in the future. Thank you all so much. Take good care of yourself. Find some time to be with yourself today. And I encourage you to know that together we can change the story of our young people and really build a school culture that truly honors and affirms their identities. So I thank you and sending you all so much gratitude and love. Thank you so much.